Mr. Andrew Smith.
Thank you, Mr Deputy Speaker. Can I congratulate the Honourable Member for Pudsey in bringing forward this motion and the way in which he's argued so powerfully the case and for it. I think this debate really does show the value of backbench-initiated topics, enabling the House to speak out on an issue of enormous concern to the public, as witnessed by the petition he referred to, as witnessed also by the Southern Daily Echo petition of nearly 250,000 signatures taken to Downing Street earlier this week in support of the Southampton Centre, which is mainly what I want to speak about. And I just want to make a few key points, and a lot of people want to get in. First, I want to praise the work which has been done at the existing centres, including that in my own constituency at the John Radcliffe Hospital, which commands fantastic support from the parents of children who have been treated. The Young Hearts organisation, set up to support parents of children with heart conditions in Oxfordshire, has been leading a great campaign, rightly paying moving tributes to the skill and dedication of surgeons, doctors, nurses, the whole medical teams by whom children's lives have been saved and to whom we all owe a debt of thanks. Secondly, as the Honourable Member for Pudsey said, an absolutely key concern in this debate and in considering the safe and sustainable review must be to secure the best possible treatments and outcomes for children with congenital and other heart conditions. We do have to be guided in this by medical and research expertise, which few of us in here are in a position to second guess. And I'm therefore very mindful of the joint statement by the Royal College of Surgeons and the Society of Cardiothoracic Surgery strongly supporting the concentration of treatment centres. They said in their statement, and I quote, "England has the right number of heart surgeons treating rare heart conditions in children, but we do know that they are thinly spread over too many units. A better service would be provided if this expertise were condensed in fewer units with the critical number of staff to support each other, disseminate new techniques and train the next generation of specialists." They said they believe the proposals, and again I quote, "will result in rapid and significant improvement in treatment for some of the most vulnerable patients treated by the NHS." And I think that unequivocal statement is one we should give great weight to in this debate. They went on to say, though, and this brings me to my third point, the benefits of undertaking this change, however, need to be balanced against longer journeys for some families. And this, along with quality, is a very strong concern on both sides of the House, certainly in Oxfordshire, stressed both by the Oxfordshire Joint Health Overview and Scrutiny Committee and the Young Hearts campaign, in terms of the implication for patients in our area if any option other than B, which retains the centre at the Southampton University Hospitals Trust, were to be chosen. As the Oxford Mail editorial today says, if Southampton loses out in the government shake-up of children's heart services, then so does Oxford. The benefits of this option, and in particular of retaining Southampton, are not only that the Kennedy Review ranked Southampton highest in the country outside London for quality, but that the Oxford Radcliffe Hospitals Trust has developed a joint network of care with Southampton, enabling local children who have surgery in Southampton to receive follow-up care and support services in the excellent facilities at the Oxford Children's Hospital, with them being able to progress as they grow older to the Oxford Heart Centre, thereby maintaining the continuity of care which the Honourable Member for Pudsey rightly said was so important in the relationship between children's and adult services. I very much hope, Mr Deputy Speaker, that this South of England congenital heart network, with Southampton and Oxford working closely together, will be part of the finally chosen option. That network does not figure in the present options, though I welcome the news in today's briefing from Safe and Sustainable that a specialist team is examining it. The need for this flexibility is a key reason why I support the call in the motion that the Joint Committee does not restrict itself narrowly to the options as set out in the original review. As Young Hearts have pointed out, It's important to have regard to the children also needing paediatric cardiac services who weren't born with a heart defect, but who have suffered a virus or an accident requiring cardiac treatment. The Oxford-Southampton Partnership will retain ready access to the skills and facilities needed for this care. This form of partnership network, with collaboration between a surgical centre and another cardiac care centre, indeed offers a good model, I think, for other parts of the country. It can enable us to make sure that children have the benefit both of the critical mass of surgery, which the surgeons advise can significantly and rapidly improve treatment, and more convenient access to related services and continuing care nearer their homes. That surely is the outcome we all want to see, and I very much hope the review and the government will take it forward with the Southampton and Oxford Partnership, the best way of retaining high quality and accessible services for Central Southern England.